If you are a senior on Social Security or Medicare, this Social Security update is one you would not want to miss. There is a lot to cover today. I am going to talk about President Trump's $4,000 gift to seniors. And then seniors are being left with 165,000 shock in massive debt. I'm going to talk about that. And then there's a lot of talk about cut to Social Security, but how do seniors really feel about it? A survey just came out that details what seniors really think about Social Security cuts that have been talked about in the media, in Congress, and what seniors really want to say about it. And then there is breaking news. President Trump is actually supporting the Senate Republicans' effort to actually cut Medicare. This is new. President Trump has always said he would not touch Medicare, but it looks like with Trump's permission, the Republicans in the Senate are looking at just that. I am going to bring you the news again. We don't talk politics here. We just bring you the straight facts, and then you make your own decision about what it means for you and your benefits. And then I'm going to talk about possible Social Security payment delays. This is from the USA Today. And then President Trump just issued a fresh new executive order on Medicaid. And then, as usual, I'm going to answer your questions live. So stay to the end of this broadcast because I'm going to do a live Q&A answering questions that have been sent to me previously that I'm going to talk about. And I'm going to answer your questions in the comments live. So if you have any question at all you want to ask me today, put it in the comment section right now, and I will be happy to answer them. So let's jump in. There's a lot to cover today. I am Kwame Kuadey, and I am a personal finance and government benefits expert. For 15 years, I have helped seniors get the benefits they deserve. My job is to keep you up to date on everything that's happening with Social Security, food stamps, Medicare, Medicaid, and more. Anything that impacts seniors and their retirement benefits, I am here to bring it to you live. And then I am also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. So let's get started. Let's talk about President Trump's $4,000 gift to seniors. What does that mean for you? You've probably heard the big, beautiful bill that President Trump has called, and it has passed the House. It's supposed to give a $4,000 bonus to seniors, but there's a lot of confusion around it. Who is going to get it? Who is eligible? If you are not paying taxes currently, are you eligible for this benefit? Well, the Tax Foundation has done an analysis of the big, beautiful bill, and I am going to share my screen and show you what exactly they are saying about this. So let me pull my screen up, and then I'll walk you through what's happening with that. So let's take a look here. So essentially what they did was that President Trump originally wanted to do no taxes on Social Security. That was his campaign promise. He was going to eliminate taxes on Social Security. But now, for some reason, they're not able to do that. So now they are offering a $4,000 senior deduction. And so what the Tax Foundation did was they are trying to compare how does the president's original promise of no taxes on Social Security compare to the 4,000 senior deduction. So I'm going to walk you through this and read what they are saying about this. So they said during the 2024 election campaign, President Trump promised that he will eliminate all income taxes on Social Security. But the House has passed the one big, beautiful reconciliation bill that does not include this provision, but it does increase the additional standard deduction for seniors. While both policies will generate little economic growth relative to their costs and increase the deficit, they have different impacts on households depending on where their incomes reside in the income distribution. So the taxation on Social Security is a recent phenomenon. It was introduced in 1983 by President Reagan, and it's been a thorn in a lot of people's side. To determine how much is taxed, you have to determine what is called the combined income. So if your combined income is more than $25,000 as a single person, you're going to pay taxes on your Social Security benefits. As a couple, if your combined income is more than $32,000, you are going to pay those taxes on your Social Security. Now, let's talk about the deduction, because part of what they have done is introduce this senior deduction. What does that mean, or enhance the senior deduction? So, under current law, seniors already are eligible for an additional standard deduction. Deductions, seniors over age 65 may claim an additional standard deduction of $2,000 if they were married, or $1,600 if they are unmarried and not a surviving spouse. So here is where the change is going to happen. The proposal in the House Reconciliation Bill provides an additional $4,000 senior deduction for individuals for 2025 through 2028. So in addition to the $2,000 senior deduction as a couple and $1,600 as an individual, there is now a further $4,000 deduction for seniors, and makes it available to those who itemize their deduction also. Now, here's how it's going to work. The deduction will phase out at 4% rate if your modified gross adjusted income is more than 75% for a single person and 150,000 for a married person. So, what does this mean for you? Why should you care? Well, the president was going to eliminate taxes on Social Security in order to help seniors, put more money in the back, account of seniors because of rising costs. Everything has gone up: food, electricity, transportation, fuel, housing. And so this was the president's idea to bring relief to seniors. But in the reconciliation bill, Congress is not allowed to change Social Security through reconciliation. They have to pass a separate legislation. And the chances of that happening in today's environment is probably going to be hard. So what they're trying to do is that they have this one shot to do this reconciliation bill. And so they are putting in this $4,000 gift that the president is putting in for seniors. And so it enhances the senior deduction. So here is what the Tax Policy Center is showing, that essentially, I'm going to go down and read it to you. He said, example, exempting in Social Security from income taxes would not change the after-tax income for the bottom quintile, as those households are already exempt from taxes on Social Security. So what it means is that the president's idea of eliminating taxes on Social Security was only going to help the higher earning seniors. If you were not paying taxes on Social Security, that was not going to help you. So it was going to leave 40% of seniors without any relief. So even though it was one of the biggest campaign promises of the president, 60% of seniors were going to benefit from it, and 40% of seniors who don't pay taxes on Social Security were never going to benefit from that promise. So the Tax Policy Center is saying that the tax cut, which is the $4,000 tax cut, will be tilted more towards the higher income household than the proposed $4,000 deduction. So overall, the increased senior deduction, the one that is in the current bill, with the phase out, would deliver a larger tax cut to lower and middle income households compared to exempting all Social Security benefits from taxes, which would not weaken the trust fund, the Social Security trust fund. So essentially what this analysis is saying is that the president's original idea of eliminating taxes on Social Security was only going to benefit the higher income earning seniors. By putting this $4,000 deduction, this would benefit more seniors in the lower to middle income category. So that is what this analysis, this long analysis, is essentially saying. So let me know what you think about this idea. Do you think the president should have honored his commitment to cut taxes on Social Security like he promised? Or do you think, based on this analysis by the Tax Foundation, that including the $4,000 or enhancing the senior deduction and adding this $4,000 senior deduction is a much better relief for lower income and middle income seniors? Now, the question is, how many people are going to be significantly impacted by this? That remains to be seen. If you are not already paying taxes, there's not a lot of relief, but this is at least better than the original plan. So let's talk about the next thing I want to discuss with you, which has to do with seniors that are finding out that Medicare is running them into serious debt. $165,000 shock in Medicare debt, and I'm going to explain to you why this is happening. I am going to share my screen and then walk you through this breaking news about how seniors are struggling with Medicare debt and what you should know about that. So this analysis, it says what Medicare does not pay for becomes a hefty debt for millions of seniors. So why should you care? Well, here's the thing. A lot of seniors don't know that a growing number of retirees are grappling with healthcare debt due to medical bills. Medicare, which provides health insurance coverage to more than 66 million people, covers the lion's share of costs for medical care, but it doesn't cover everything. And that is what is causing a lot of seniors to acquire massive amount of debt because Medicare does not cover everything that you need. And so what this article from Yahoo Finance is saying is that on average, the senior, a 65-year-old senior who left the workforce last year may need $165,000 in savings to cover out-of-pocket healthcare expenses through their retirement. A combination of medical bills not covered by Medicare for the retired couple, this is describing a retired couple that they're talking about, the Mortons, ended up making them owe $90,000 and they're still in retirement. And so this story that they did about this couple that has run up debt, who live in Colonial Beach, Florida, Virginia, have run up $90,000 in debt just from co-pays and all these other out-of-pocket medical costs. And so it's estimated that an average senior would need $165,000 in savings to cover just out-of-pocket medical care expenses alone. And here's another fact. 1 in 10 people age 65 or older with healthcare debt owe more than $10,000 or more, according to a Kaiser Family Foundation study. Consider that half of all people on Medicare live on $35,000 or less. So a $10,000 bill is a lot of money. So why am I bringing this to you? Well, medical debt has become one of the serious challenges that seniors are facing right now. Every time I do a video, somebody is commenting about how much debt they've accumulated, struggling to pay medical bills. And so this kind of validates the fact that seniors are struggling and that Medicare cost is running rampant and Social Security increases are not catching up to Medicare increases. And so as a result, a lot of seniors are finding themselves in a serious debt situation. So if you've been impacted by this, if you are accumulating medical debt because of Medicare, out-of-pocket expenses, co-pays, etc., I want to hear from you in the comments. Let me hear your story because I want to share these stories and highlight them in my videos so that people will come to understand what is happening with seniors and how the promise of help, especially medical help, has not really materialized because seniors are facing a situation where their Social Security increases are being consumed by Medicare costs, and it gets worse and worse and worse. And now you need $165,000 in retirement just to pay out-of-pocket costs just for one person. And so let me know what you think in the comments. Now, the third thing I want to talk about is very, very important to a lot of seniors today because everywhere you turn in the news, they are talking about cutting Social Security because Social Security Trust Fund is going to run out of money in 2033, and Social Security beneficiaries are going to get a cut in their benefits by 21% minimum. Some are even saying up to 30%. So what do seniors think about this? Well, I did some research and I found something that may surprise you about this particular topic. So I am going to share this study with you and let me know what you think because I think this is why a lot of seniors are filing for Social Security early because they are afraid or worried that Social Security may not be around, or at least they may not get the full amount that they are eligible for, um, given how things are going. So what I'm going to do is I'm going to share this study with you and show you what is happening with that. So let's see here. There we go. Give me a second. Let me pull that up, and then we'll talk about it. Okay, there we go. Um, okay, here we are. So this is a study from the Pew Research Center. What the data says about Social Security, and it's a very big study, but I've analyzed it already. So I'm going to give you the key parts that you should be concerned about. So basically, they went out and did an extensive study. 79% of US adults said Social Security benefits should not be reduced in any way. You know, so they're starting by saying few, if any, program of the US government touches as many people directly as Social Security. Nearly every working American pay into Social Security through taxes, and more than 55 million people receive monthly benefits. Millions are also collecting disability. Social Security has long been one of the federal government's most popular programs. And in a 2024 Pew survey, 79% of US adults said Social Security should not be reduced in any way. Now, this view is in conflict with what's happening with Social Security, because the trust fund, which is the fund, Social Security of money in 2030. And if Congress does not do anything, there's going to be an automatic 20% cut, at least 20%. Some are saying all the way to 30%. But seniors don't want that to happen. So something has to change. So let's talk about what has to change. The Trump administration has also made deep staff cuts to Social Security Administration, the independent agency that manages the program. The SSA had 58,000 employees, and now they have about 50,000. So against this backdrop, here are some of the answers about what's going to happen to Social Security. Now, currently, one of the biggest problem is that a lot of money, the amount of money coming into the Social Security system is not enough to pay the retirees that are retiring right now. That is a fact. And a lot of people don't know that Social Security is not they don't have like a big account of money. The money that you pay into from your paycheck into Social Security is not sitting in some account. That money you pay today is used to pay for beneficiaries who are collecting money today. That is how the system has always worked. So if you don't have enough people working and paying into the system compared to how many people are withdrawing from the system, then you have this problem. And so you have to dip into the rainy day fund to make up the difference. Well, the rainy day fund is going to run out of money in 2033 if Congress does not find a way to bring in more money into that rainy day fund, or slow down how much money is being taken out of the Social Security system. So essentially, what this study is saying is that something has to change, because more people are collecting Social Security. 73.9 million people are collecting. There's 52 million people who are collecting retirement benefits. There's 2.7 million spouses and children who are collecting from retired workers' records. There's 5.8 million people that are collecting survivor benefits of deceased workers. 7.2 million people that are getting disabled workers benefits, which is SSDI. And then there's 1.1 million spouses and people who are, 1.1 million spouses and children of disabled workers who are also collecting benefits. And then you have 7.4 million people receiving supplemental security income, which is disability benefits or low income. So that is the breakdown of everybody that's collecting Social Security benefits. 75% are retired workers, 10% are disabled workers, and then the rest is other people that are collecting benefits, spouses, deceased benefits, etc. So 73 million people depend on Social Security today. And there are not enough people paying into Social Security to pay all the money that is due to these 73 million people. And Congress has not done anything to try to bring in more money. There are two things they can do to bring in more money into Social Security. One is to increase the Social Security payroll tax. And according, this article talks about it a little bit here. Social Security is funded through 12.4% payroll tax, half of which is paid by the worker, half of which is paid by the employer. If you're self-employed, you pay the entire 12.4%. Most of the tax revenue, 85%, goes to the retirement and survivor program, while 14.5 goes to the disability program. So that's important. So the Social Security taxes that are received into the system, 85% go to pay retirement benefits, 14% go to pay disability benefits. So that's important for you to understand. Now, in 2023, nearly 183 million workers paid into Social Security. That amounted to roughly 93% of the US workforce. About half of Social Security recipients also pay taxes. So when you pay taxes on your Social Security, that contributes about 4% into the Social Security system in terms of revenue. That is where all the money is coming from. And then it goes to pay retirement benefits for seniors. So what should be done, or what needs to be done? Well, the average Social Security beneficiary is getting $1,999. The average disabled worker is getting $1,581. The average SSI recipient is getting $717 as of 2025. And that is $134 billion in benefits that is paid monthly. So there's a lot of money that's being paid. And a lot of seniors depend on Social Security as their only income. So if Congress wants to fix this, here is the problem. And as the article is saying here, there's this demographic issue or a demographic time bomb that is ticking because less people are working that are paying into Social Security. Now, the question is, why is that? So I want to hear from you. Why do you think that we're in 2025 and less people are working and paying into Social Security versus people that are collecting from the system? There's less money coming in. It used to be decades ago, there were more people paying into the system that were collecting. Now there's more people collecting than are paying. Why do you think that is? I want to hear from you in the comments section below. But the problem is that something has to be done. So the study is saying that the aging US population means that the number of beneficiaries receiving money from Social Security is growing faster than the number of workers paid into it. And from the beginning, Social Security was designed as a pay-as-you-go system. So the taxes paid by today's workers fund payments for today's beneficiaries. So Social Security does not operate like a savings account or an individual retirement account where the money that you paid in is sitting there for you. It doesn't work like that. The money you paying today is paying for beneficiaries today. That's how it was designed from the very beginning. And so if it's not enough people to pay into it when you are retired, then Congress has to do something about that. And so as the baby boomer generation has aged out of the workforce in retirement, the ratio has fallen drastically. In 1965, for example, there were about 4 times as many workers paying into the system as were beneficiaries. Think about that. In 1965, there were 4 times as many people working compared to people who were taking benefits. Now, in 2023, the year that this report covers, there were 2.47 workers to each beneficiaries. By the end of the century, the ratio is going to decline to 2.1. So here is the problem right there. 4 workers to a beneficiary back then now is 2.7 workers to a beneficiary, and it's going to go to 2.1 to a beneficiary. So there's a demographic problem. And unless we get more people working and paying into the system, or increase the tax rate, or there is a Social Security taxes cap. If you make up to $176,000, you pay Social Security taxes. That's it. If you make $1 million, you only pay taxes on the first $176,000, $100. If you make $1 billion, you only pay Social Security taxes on the first $176,100. So there's a lot of money that's being left on the table because not every income is taxed for Social Security. So one way that Congress can fix this problem and bring in more money is to increase or remove that cap so that everybody will pay taxes, at least Social Security taxes, on every money they make. That will solve the Social Security problem for 75 years. Why wouldn't Congress do this? It's all politics. Or they can raise the Social Security tax rate from 6.2% for employees to maybe 6.5%. That's not going to solve the entire problem, but it will help. So I want to hear from you because the survey from this article is saying that, you know, a lot of seniors do not want Social Security to be cut. And even though the reality is that in 2033, benefits will have to be cut if nothing is done. So, what do you think should be the solution to this Social Security problem? I want to hear from you in the comments section below. So, now let's talk about the next thing that is on my list to discuss with you today. The Senate GOP eyes Medicare cuts with Trump's blessing. So President Trump promised that he's not going to cut Medicare, Medicaid, food stamp. Well, he didn't say food stamps, but he said he wasn't going to cut Social Security, Medicare, Medicaid. And now it looks like not only are they cutting Medicaid in the current bill, but they're about to cut Medicare. Let me show you the article where I am getting this news information from so that you can make the decision for yourself whether you think that is what is happening or you think something else is going on. So let me pull this article up and then we'll get right to it. So this is from Politico, and it is saying that Medicare is the target as GOP faces mega bill math issues. So what does that mean? Remember, President Trump is trying to extend his tax cuts from 2017. They need to find the money in order to pass that legislation to extend the tax cuts. Otherwise, it's going to blow up the national debt and the deficit. And so they need to cut and find the money from somewhere. Now, I'm going to show you where the government spends its money. That way we can all be on the same page of why Medicare and Social Security is now, especially Medicare, is on the chopping block because they cannot find the money. They need about almost $2 trillion, and you cannot find $2 trillion in the government spending without taxing Medicaid, Medicare, and Social Security. It's just the math is impossible. And so that is why we're here. So let's read a little bit of this Politico article. It said Senate Republicans are eyeing possible Medicare provisions to help offset the cost of their mega bill as they try to appease budget hawks who want more spending cuts embedded in the legislation. Making changes to Medicare, the federal health insurance program primarily serving seniors, will be a political long shot. It will face fierce backlash from some corners of the Senate GOP, not to mention across the Capitol, where Medicare proposals were previously floated but never gained traction. But some Senate Republicans are now seriously considering it as a race to pass their party line tax and spending package before their self-imposed July 4th deadline. The idea came up in a closed-door meeting this week. Crucially, some Republicans believe President Trump is on board with touching the program as long as it is limited to waste, fraud, and abuse. And here's what I think. I think that every time you hear waste, fraud, and abuse, you should be very suspicious because they are using that as cover to touch everything, and they get to determine what is waste, fraud, and abuse. And so if you are receiving a particular benefit, for example, seniors now get telehealth, where if you are sick and you live in a rural area, you can get medical care through your doctor, through your device. That costs money. Medicare has to pay for that. There's prescription drug cap. This year, legislation was passed that you cannot be charged more than $2,000 for prescribed medication if you're on a Medicare drug plan. But that costs money because after you pay your out of pocket cost for $2,000, Medicare will have to take it over and pay. So even if you have a $50 bill for your medications, a $50,000 bill, $20,000 bill, $10,000 bill, regardless of the medication you're taking, how expensive it is, once you pay your $2,000, you're done. The Medicare has to pay it. That's coming from the Medicare pot. So they can determine that is waste or abuse and remove it. So whenever they say waste, fraud, and abuse, we all think that they're going to do something that's not going to impact us. It's going to be whoever is cheating the system. That's not what's going to happen. When they are looking for money to pass a tax cut bill that primarily benefits the super wealthy, and they can't find the money, and all of a sudden they open the door to touch Medicare, and they said they are only going to touch it for fraud, waste, and abuse, you should be suspicious because they're going to cut deeper than you think, and all of a sudden something that you were relying on is gone, but they'll tell you we did not touch Medicare. But well, you did because you took away some benefits that seniors were relying on that Medicare pays for. So let's look at this article a little bit more. So I think anything that is waste, fraud, and abuse are seriously open to discussion. That's what the Senate Majority Leader said. And he said, the focus, as you know, has been on addressing fraud, waste, and abuse. But right now, we are open to suggestions if people have them about other areas where there's clearly waste, fraud, and abuse that can be rooted out of the government. So you're going to hear a lot of this phrase being used. And I am suspicious of that because I think that is the backdoor way to cut benefits that seniors are depending on. But I'm going to read from you another article from Axios that gets straight to the point because I think they are pretty much saying what a lot of us are thinking, that this is a backdoor way to cut benefits that seniors depend on. So here we go. So Axios is seeing the same thing. Senate Republicans eyed Medicare cuts with Trump's blessing. President Trump gave Republican senators a green light to explore ways to save money on Medicare during a meeting at the White House. Why does this matter? Changes to save money on Medicaid have already proven contentious with Republicans, and Medicare could now open a whole can of worms. The president is willing to eliminate waste, fraud, and abuse. That's what they're saying. But what the president made clear is he does not want to see any cuts to beneficiaries, but to go after the waste, fraud, and abuse. And nobody has defined what waste, fraud, and abuse is. So I want to hear from you. If you think you know what waste, fraud, and abuse in Medicare really means, let me know in the comment section below. What do you think that means, and what do you think they should be specifically looking for? Because when they say that, I don't really know what that means. They never define it, but they keep saying it. So I want to hear from you in the comment sections below. As I said, look, I'm not about the politics of this. I just smell something and I'm going to let you know that's how I'm seeing it. And you can draw your own conclusion. But I think that if they were not struggling to find money, they would not have be open to the idea of touching Medicaid because they've cut from food stamps, they've cut from Medicaid, and they still cannot make up the $2 trillion they need. And so where else can they look? They will have to look at Medicare and Social Security, maybe. So that's what I think. Let me know what you think in the comment section below. I'm looking forward to hearing your thoughts about this. And then there are two things, and then I'll answer your questions. I have a live Q&A that I usually do. So I have about 10 questions that people have asked that I want to address. And then I want to answer your questions in the comments. So if you have any questions at all that you need me to answer, go into the comments and let me know, and I'll be happy to answer it. So there could be possible delays to your Social Security check. This is coming from USA Today. So let's look at it and let's talk about it. So USA Today is saying that some Social Security employees warned of delays because they are prioritizing specific individual accounts that they've been told they need to focus on processing. So let's go through this and understand what's happening. If you need to update Social Security about a move or bank account change, get in line. It could take longer than usual, employees say, as they prioritize processing 900,000 complicated cases in hand. Changes like this may take longer, and thousands of Americans could see delays or even stopped Social Security checks in the meantime. That is what Social Security employees are telling USA Today. This is because Social Security officials have tweaked what they want some employees to treat as priority for at least the next month to include about 900,000 complicated cases that must be handled by hand. While the White House says the additional work won't affect other beneficiaries, employees, Social Security employees, tell USA Today that adding something new and complicated on top of their daily to do list means other work does not get done. Some of the work that they expect to fall through the cracks, like changing direct deposit information or fixing problems with Medicaid billing, will mean the difference between receiving a check or not. That's what they're saying. So, what has changed? Well, the Social Security Administration is processing a lot of benefits and are prioritizing some particular benefits. In May, employees were told to prioritize processing the Social Security Fairness Act payments. If you're not aware of that, there's a $6,000 lump sum payment as a result of the Social Security Fairness Act, and then an increase in monthly benefits for 3 million seniors that were impacted by the Social Security Fairness Act. So now it seems like the Social Security Administration is prioritizing those payments. So if you have to change your direct deposit or you moved, anything that affects your benefit that you have to change may wait, and that will cause the delay. And they're saying that, this can affect a lot of people because a lot of seniors, if you have 73 million people receiving Social Security benefits, about a million are changing something every month, whether it's direct deposit or change of address. And so those are going to be delayed in terms of processing, and as a result may delay your check. So maybe if you want to change your direct deposit, you should wait until this backlog is cleared in a few months before you do that. Because if you do and they're not able to process it manually, your benefits may be stopped, and that could impact you and your budget. And then finally, President Trump has issued an executive order hot off the press on Medicaid. Now, there's been devastating cuts to Medicaid in the big, beautiful bill that is going to knock about 13 million people off Medicaid. That is a crisis that is about to happen. The president just issued a new executive order on Medicaid. I want to read it to you so that you can see what he's trying to do here. So let's go to that release from the White House and look at it. So as you can see in plain language, eliminating waste, fraud, and abuse in Medicaid. So, guys, I don't mean to be cynical here, but I am getting really suspicious of this phrase because knocking 13 million people off Medicaid is not just because of fraud, waste, and abuse. And I think that, we should all want to understand specifically what are in those categories so that people can stay informed. But here's the president's executive order. I want to read it to you. It says that my administration has been relentlessly committed to rooting out fraud, waste, and abuse in government programs to preserve and protect them for those who rely on them the most. The Medicaid program was designed to be a program to compassionately provide taxpayer dollars to healthcare providers to offer care to the most vulnerable Americans. To keep payments reasonable, billable costs for such care was historically capped at some level. The state and federal government jointly share the cost to ensure that these lesser means do not go untreated. Under the Biden administration, states and healthcare providers were permitted to game the system. For example, states tax healthcare providers but send the money send money back to them in the form of Medicare payments, which automatically unlocked for healthcare providers an additional revenue. So the president is saying that this is one area that he's identified as waste, fraud, and abuse, and the state directed payments are about $110 billion in 2024 alone. So that is one area that he wants the Secretary of Health and Human Services to do something about. And he's saying that I pledge to protect and improve these important government benefit programs for those who rely on them. And here's the part about seniors. Seniors on Medicare and Medicare recipient both deserve to access quality care in a system free of fraud, waste, and abuse. We will take action to continue to love and cherish the Medicare and Medicaid program to ensure that they are preserved for those who need it the most. The Health and Human Service Secretary shall therefore take appropriate action to eliminate waste, fraud, abuse in Medicaid by ensuring that payment rates are no longer in Medicare to the extent permitted by applicable law. So, what do you think? The president has identified an area of waste, fraud, and abuse that he wants to tackle. Do you think this executive order goes far enough in eliminating waste, fraud, and abuse? Do you think that more people are going to be dropped off the Medicare program in addition to the 13 million that's going to lose benefits from the big, beautiful bill? I want to hear from you in the comments section below. So, next, I am going to my favorite part of the broadcast, which is the section where I get to answer your questions. But before I do that, I want to know where you are watching this broadcast from. Let me know your city and your state. So go into the comment section, do me a favor, let me know your city and your state. I love to know where people are watching our videos from. So hit me up in the comment section below. And next, I want to talk about your questions, the questions that I've received. I have compiled them, and today I'm going to address them one by one. I have 10 that I pulled that I'm going to talk about. And it's mainly going to focus on Social Security spousal benefits. So here's the first one that I want to bring up, and then let's talk about it. So give me a second. Let me get my screens sorted out here. So this is a question from Linda. She said, I am a 63-year-old homemaker named Linda. My husband and I turned 67. My husband just turned 67 and started collecting Social Security. I never worked outside the home. Can I still get benefits on his record? And how much would I receive? Well, here's the thing. Yes, Linda, you can receive spousal benefits as long as your husband is collecting Social Security and you are at least 62. That is the most important part. Number one, your husband has to collect benefits, has to start collecting benefits, and you have to be at least age 62. That's the minimum age to collect Social Security. And the maximum you can get is 50% of your husband's Social Security benefits at his full retirement age. But since you are taking it before your full retirement age, your benefits will be reduced by about 32%. So there are a couple of things happening here. The first one is that your husband should be collecting benefits for you to be eligible. Number two, you have to be age 62 or above to collect benefits under his record. Number three, you are entitled to up to 50% of his benefits that he would have received at his full retirement age, regardless of when he started collecting benefits. So, but if you are taking the benefits early, before your full retirement age, then your benefits will be permanently reduced to about 32.5% of what he would have received at full retirement age. So you are going to drop your numbers from 50% of what he would have received to about 32% if you don't collect at full retirement, your full retirement age. And if that 32% is lower than what you would have collected on your own record, then they will pay you your Social Security benefits based on your own record. So I hope that makes sense. It's there's several layers to that, but the most important thing is that he has to start collecting benefits, and you have to be age 62 or above, and you're entitled to up to 50% of his earnings, Social Security earnings, at full retirement age, at his full retirement age. So I hope that clarifies that for you. So let's go to the second question here. So the second one is from Mark Foster from Iowa. My name is Mark, 65, and my wife is 62. She worked part-time and qualified for a small Social Security benefit. Can she get a spousal benefit? And if so, how is it calculated? Well, here are a couple of things that, Mark, you need to know. So your wife can receive spousal benefit if her own Social Security benefit is less than what she would have received under your record at full retirement age. Now, Social Security will pay her own benefit and then give her what they call a top up based on the difference between what she would have received on her own record and what she will receive under your record. And if she claims it at 62, like I talked previously, then she's going to get just 32.5% of your Social Security benefits at your full retirement age. So let's say, for example, that your full retirement age, you'll get $2,000. She can get up to $1,000. But if she's collecting early at age 62, then she's going to get $600, about $600. So she's losing about $400 because she's collecting Social Security early at age 62. So that is why spousal benefits can be tricky. But the key here is that it's whatever benefit you're going to get at your full retirement age, she gets up to 50% of that if she's age 62 or older. Now, I want to hear from you. So if you are in the comments and you have a question, let me know your questions. I see somebody. Let's see. I'm going through just the comments and trying to see if there's something that I can answer. I don't see anything, but if you're here, join live, or if you watch this video after it is posted, after the live, just leave a comment, because I go back and look through the comments, and if I find something that needs answering, I will just add it to my list, and then when I record the next video, I'll pull it up like I'm doing right now, and then I'll answer it. So let's go to the third question in this series. So number 3, this is from Susan. Susan, 62, divorced after a 15-year marriage. My ex is 66 and hasn't claimed Social Security yet. Am I eligible for spousal benefits? Well, Susan, yes. As a divorced spouse, you can claim spousal benefits if you were married for more than 10 years and are currently unmarried and you are at least age 62. So those 3 conditions must be met. Number 1, you were married for 10 years or more. Number 2, that you are currently age 62 or more. And number 3, that you're currently unmarried. So those are the conditions. If you meet all 3, then you are eligible for benefits, even if your ex-spouse hasn't started collecting Social Security benefits yet. Now, your ex does not need to have filed for their benefits, but they must be eligible and must have been divorced, for, the divorce must be at least 2 years. So you must have been married for at least 10 years and divorced for at least 2 years. And you can receive up to 50% of their benefit at their full retirement age. But again, like previously, like the spousal benefits, if you claim early at age 62, then you're going to get a reduced amount. So you claiming spousal benefit based on your ex-spouse's record does not affect their record. So they don't even have to know that you are claiming benefits under their record. You are entitled to that all you need to do is prove that you were married for 10 years, you're divorced for at least 2 years, you are 62 or older, and you are currently unmarried. That's all. And then you can claim based on your ex-spouse's record. So I hope that was helpful to you. Moving on, here's this. My name is John, 67, and my wife is 60. If I delay my Social Security to age 70, will her spousal benefits increase? So John is trying to find out if he waits till age 70, where you get the maximum Social Security benefit that you are entitled to. Will that affect spousal benefit? No. John, your wife's maximum spousal benefit is always fixed at 50% at your full retirement age. So even if you wait till age 70 to get more money yourself, your spouse's spousal benefit is capped at 50% at what you would have received at your full retirement age. So if you delay and receive a higher best personal benefit, your person, only your survivor benefit, that will not affect your survivor benefit. For example, if your full retirement age, you're getting 2,000 and the maximum spousal benefit is 1,000, even if you delay and you get 2,500 at age 70, the maximum spousal benefit will still be 1,000. So I hope that's helpful. So she can claim spousal benefit anytime that fits her, but you waiting till age 70 does not make her get more money in spousal benefits. Let me check the comment section to see if there's anything came in. Um, isn't SSI on the brink of being dissolved under Trump? That is from Dolly. Well, that's the rumor. That's the rumors that are going around that the SSI program, that congressional Republicans believe that the SSI program is filled with fraud and abuse and it's not necessary. But I don't know if that's going to be eliminated, because there's a lot of problems with eliminating SSI. One reason is that a lot of children, a lot of seniors are on SSI in addition to Social Security. A lot of people don't know that. And so it will be cutting another source of income for seniors. A lot of veterans who don't qualify for VA benefits ended up on SSI. So if you eliminate SSI, you are going to create a lot of problems for veterans. So I'm not sure. They probably, like everything else they're doing right now with food stamps and Medicaid, they're probably going to cut deep into SSI, but I'm not sure they're going to eliminate it completely. That's just my sense. All right, so let's go to the next question. If you have any questions, let me know in the comments. I am happy to answer your questions. Here's another one from Marie. Let's see. Let's go back. Um, it says that, Maria, I am 64 years, remarried after being widowed. My new husband is 66 and just filed for Social Security. Can I get spousal benefit on his record? Yes, Maria, as long as you have been married to your new husband for at least 1 year and he's collecting Social Security, you are eligible for spousal benefit. So those are the two conditions that must be met. You're married for at least 1 year and he's collecting Social Security, then you can collect Social Security under his record, your new husband. Now, again, it's going to fall under spousal benefit, so you're going to get 50% of what he would have received at his full retirement age. But if you are collecting it early before your full retirement age, then you're not going to get the whole 50%. You're going to get a reduced amount. If you're collecting at age 62, then you're going to get about 32.5% that I said earlier. So remarriage does not affect your ability or your eligibility for spousal benefit on your current husband's record, but it would affect your survivor benefits from a previous spouse. So if your ex-spouse passes away, then you are not eligible for survivor benefit under that person's, because you are remarried. your current husband's record is what you're eligible for. I hope that makes sense. SR is saying if you are in full retirement, the government allows you to earn unlimited income and have unlimited savings. They are not going to give you food stamps. Go figure out how to bring income into your home. Okay, I think a discussion was happening in there, so I just bumped into that. So let's continue to talk about these questions that I have. I have Tom. So Tom is saying, I am Tom, 68. My wife never worked. She's 67 now. When should she claim her spousal benefit to maximize it? Well, I'm going to say a disclaimer here. I am not a professional financial advisor. So I'm giving you opinion based on research that I've done, and you can do as you will with it. But here's my answer. Your wife should wait until her full retirement age to be able to get the maximum based on your record. So if she's 67, she's probably at her full retirement age or past it already. So this will be the prime time to collect because she will get 50% of your Social Security that you are eligible for at your full retirement age. And here's the thing. If that 50% is higher than what she would have gotten under her own record, then that's the better choice. So there's no advantage to delaying Social Security for spousal benefits. So now that she's past the full retirement age, she can collect. Waiting any longer is not going to help because she's already at full retirement age. So if you're collecting, let's say, $2,500, then she's eligible for up to $1,250 in spousal benefits. So that's the answer to that one. So let's go to the next one. Meanwhile, I'm also looking through the comments. If you have any question at all, let me know. Here's another one. This is from Karen. I am 62 and my husband is 63 but hasn't filed for Social Security yet. Can I claim spousal benefit now? No, you cannot. I think a previous question was similar. You cannot claim until your husband files for his own Social Security. You could claim your own retirement. You could claim based on your own record if you are eligible now, and then you can switch later once your husband files. So if he hasn't filed yet, you cannot claim on his record, but you can claim on your own record because you are 62. You are eligible right now to to claim Social Security based on your own record. And if you think you're going to get a reduced amount, then you have to just wait until he files, and then you can switch to spousal benefit if what you would have received is lower than what you would get under his record. But remember, if you're claiming before your full retirement age, you're going to get permanently reduced. So if you claim early, both you and your future spousal benefit will be permanently reduced. So you claiming Social Security early based on your record and then switching over to his record is not going to give you the maximum because you started early. So you're still going to get a reduced amount. So if you want to maximize how much you're going to get, you have to wait till he reaches full retirement age. Then you can claim spousal benefit. Then you get 50% of what he would have received on his full record. I hope that makes sense. Let me go to the comments. I don't see any new comments, so I'm going to keep going. I am Steve, 67. My ex-wife is 66. We were married for 12 years and divorced for 5. She never remarried. Can she collect spousal benefits on my record? And will it affect my payments? Well, yes and no. So yes, your ex-spouse can collect spousal benefits based on your record if she's unmarried, number one. Number two, she's 62 and over, and you were married for at least 10 years, which you say you were, and you were divorced for at least 2 years, which you say you are. So she checks all those boxes. She can claim Social Security and get up to 50% of what you would have received at your full retirement age. And it doesn't impact you and what you are going to receive. You're going to receive the full amount of what you are eligible for, and they can get 50% of what you are eligible for under your full retirement age. Now, since they are 66, they are almost at the at their full retirement age, probably a few months to their full retirement age. So they'll be eligible, and they'll be eligible for 50% of what you would have received at your full retirement age, which you have probably passed your full retirement age already, but it doesn't really matter. It's based on what you would have collected at full retirement age. Finally, number 9, let's talk about Alice, 62, caring for a 14-year-old disabled child. My husband is 65 and collecting Social Security. Can I get spousal benefit now, and will it be reduced for age? Yes, you can claim spousal benefit now because you're 62 and you're caring for a child under 16 or with a disability. You're entitled to your husband's record. In this special case, your spousal benefit is not reduced for age even if you are under 62. So here's the wrinkle, okay? All other spousal benefits are what I just shared earlier, but in this case, because you're caring for a child under 16, you can claim spousal benefits and you still get up to 50% of your husband's record at full retirement age. Once you are no longer caring for a qualified child, standard age rules applies. So keep that in mind. So your benefits now will not be reduced, but when your child reaches age 16 or older, then your benefits will be reduced if you are claiming early. So I hope that answers your question. And then I have Bill. I'm 64. My wife is 67. She's been collecting Social Security since 62. Can I get a spousal benefit, and how does that early claimant affect me? So similar to what I'm saying, yes, you can claim spousal benefit at your 62. You'll get 50% of what she's receiving at her full retirement age. You get a reduced claim of 32.5% if you claim at 62. But since you're 64, you will get a little bit more, but it will not be the full 50% of the benefit that you would have received if you had waited to your full retirement age. So I hope that clarified a lot of things for people about spousal benefit. If you have any questions at all about anything, Social Security, Medicare, Medicaid, food stamps, let me know, and or you can put it in the comments. If you're watching this video later and something comes up, put it in the comments, and I'm happy to answer your questions tomorrow or in a subsequent video. So let me give you some cheat sheet. We've talked a lot about spousal benefits. So what should you know about spousal benefits? What are the big things that I want to leave you with? Well, the first one is that to qualify for Social Security spousal benefits, you have to be age 62 or older. And if you're caring for a child under 16 or a child with a disability, you also qualify. Your spouse must be collecting benefits, retirement benefit or disability benefits, before you can collect as a spouse. However, as a divorced spouse, you qualify if the marriage lasted for 10 years, you're currently unmarried, you were divorced for at least 2 years, and you're 62 or older. And even if you never worked or don't have enough work credits, you can still receive 50% of your spouse's benefit at their full retirement age. So that's the first thing you need to know about spousal benefit. Now, how much can you get? Well, you can get 50% at your full retirement age of what they would have received at their full retirement age. Now, if you claim before your full retirement age, which is between age 66 and 67, depending on when you were born, then you will get a permanent reduction to 32.5 if you claim at 62. So if they are going to get 2,000 and you are going to get 1,000 at full retirement age, if you claim at 62, you're going to get 650. So you're going to lose $350 a month permanently by claiming early. Now, if your own retirement benefit is higher than your spouse's 50%, then you'll get your own. But if it's not, then you'll get your benefit and then they'll top up with the difference. That's how that works. So spousal benefits do not increase when you wait beyond your full retirement age, and you cannot claim benefits until your spouse has filed for benefits. If you're caring for a qualifying child, you can claim spousal benefit at any age, and your benefit will not be reduced for age. Couples can maximize by strategizing so that the lower earnings couple or the lower earning spouse claims benefits first, and then the higher earning spouse can delay their benefits for the future. Now, I know you've been seeing the number on the screen, free Medicare help, call chapter at 539-205-2147. I've been sending a lot of people to our partner chapter, and this testimonial came in. I want to read to you. So this is somebody that used the chapter service and are so happy about the service that they received. And this is Michelle S. He said, I cannot praise chapter and Shannon Davis enough, which is the rep that she worked with. Shannon's knowledge and professionalism, most importantly, compassion towards me in a very frantic situation, was beyond words. Shannon treated me like family member and was able to keep me calm with minimum tears shed. After learning only 3 weeks ago that my biopsy result came back positive for cancer and my current medical insurance wasn't going to be accepted at Memorial Sloan Kettering Cancer Center in New York City, to say that I was devastated was putting it mildly, especially since I just moved 6 months ago and had to get new health insurance. If you know, when you move, you have to get new Medicare insurance. Some type of Medicare insurance are state specific. Shannon went above and beyond to find me new health insurance, even though the window has closed. And I am thrilled to report that as of April 2025, I was approved for new health insurance to begin May 1st, 2025. This is now with the help, as many of you, I am scheduled for surgery on May 9th. Bottom line, don't hesitate to use chapter. They will be helpful to you. You'll be happy you did. Enjoy, everyone. This is a real testimonial for somebody that we refer to chapter and very, very happy. So why chapter? Why are we partnering with them? Well, here's the thing. When you call them, they will show you every Medicare option available to you. They have access to all 24,000 plans. They're the only organization that has it, including detailed information about which doctors, specialists, prescription drugs, hospitals are covered, and what the copays are, and how the plan compares to Medicare, traditional Medicare. They are there to advocate for you so that you can maximize your Medicare. So if you're in a plan right now, you may switch to a better plan. They will find you a better plan. And on average, they can save you $1,100 a year. They have A+ ratings with the Better Business Bureau, tons of 5-star review like the one I just read you from Michelle S. And so these guys are the real deal. So give them a call today or go into the description to this video. There's a form you can fill out. It's very quick, and they will reach out to you and help you figure out how you can get on a better Medicare plan. 90% of all seniors are in the wrong Medicare plan. You don't want to be one of those. Call chapter today, 539-205-2147, or go to askchapter.org/insider, fill out a quick form, and they'll reach out to you. And finally, if you're not on our newsletter list, you're missing out. You're missing out on senior savings, senior discounts, breaking news, and anything in and out of Congress that may affect your benefits. We want to bring it to you. So go into our YouTube channel at the top. There's a link. Just click on that link, enter your email address, and you're part of the insider list. And you'll be getting from us with money saving tips and anything that can affect your benefits in a negative way. We're going to alert you. There's so much happening with benefits these days, and I want to be the person that updates you and brings you up to speed on that. So if you like what you heard, please hit the like button, hit the subscribe button. I really do appreciate your help, your support, and for hanging out with me here this Saturday evening. And I'm looking forward to seeing you all tomorrow and subsequent days as I bring you the latest news and update about anything that will affect your Social Security, Medicare, Medicaid, food stamps, and more. So thank you for watching, and I'll see you all tomorrow.